हेलो गुड मॉर्निंग, मैं डॉक्टर आर्यन। आज हम डिस्कस करेंगे मेडिसिन के सब इंपॉर्टेंट एमसीक्यू। A 30-year-old woman comes to the clinic complaining of a peri-orbital headache for the last 2 months. She described the headache as excruciating and stabbing and is associated with lacrimation and conjunctivitis. On the ipsilateral side, the headache starts after a cutaneous trigger. Which of the following is the most likely diagnosis? Cluster headache, SONCT, migraine and tension headache. तो ये तो बेस्ट आंसर रहता है SONCT। ये क्या है? शॉर्ट लास्टिंग यूनिलैटरल न्यूरोलॉजिफॉर्म headache. The feature of headache in this patient, the autonomic symptoms, peri-orbital pain and cutaneous trigger suggested a SUNCT. Headache is the short lasting unilateral neurologiform headache attacks with conjunctival injection and tearing. Trigeminal autonomic cephalgias are a group of primary headaches including cluster headache, paroxysmal hemicrania PH and short lasting unilateral neurologiform headache with the conjunctival injection and tearing. The conjunctival injection and tearing is the shunt. SONCT, the feature of the cluster headache shunt like that in gender, pain type, severe site and cluster headache, male more than female, stabbing, boring, excruciating orbit, temple. Next question. A man complains of 2 days of momentary rotatory dizziness lasting among 1 minute, visual juddering, disorientation and lightheadedness. This occurs when sitting up from lying, turning in bed and quick head movement. Which test should be done? Zilla test, Rina test, Weber test, head impulse test. The best answer is the head impulse test because here the patient experiencing visual judging, lightheadedness when sitting up and turning his head, the point of vertigo and mainly benign paroxysmal positional vertigo. Benign positional mainly benign paroxysmal positional vertigo, which is the checked for head impulse test. A chatty or head impulse test is a bedside technique due to the diagnosis of reduced vestibular formation. Next question. A 24-year-old man was throbbing left side headache that with movement and are aggravated by loud noise. He also has nausea. The patient needs a dark, quiet room during episodes. Which of the following best explains the pathogenesis of the patient headache syndrome? Diffuse muscular contraction of the neck and scalp, disinhibition of the central pacemaker neuron in the position hydrothalamic region, dysfunction of the monoaminergic sensory control system in the brainstem and hypothalamus. This one is the best answer. Here because the patient described, but what typically of the migraine headache. The second most common cause of the headache and the most common cause of headache is related disability. This one the migraine headache, the second most common cause of the headache है and most common cause of headache related disability है. And like that common triggers include lack of sleep, excessive sleep, stress, hormonal fluctuation, alcohol, barometric pressure changes. Next question. A 61-year-old female patient present to your clinic due to sudden episodes on left-sided facial pain for the last 2 days. She stated that the pain feels like a sharp stabbing and is a 9/10 in terms of intensity. The pain lasts about 5 to 10 seconds and then dissipates rapidly. The pain is often brought on by talking and cold wind. Her past medical history is significant for depression and type 2 diabetes mellitus. What is the diagnosis? Giant cell arthritis, shunt syndrome, trigeminal neuralgia, and paroxysmal hemicrania. Trigeminal neuralgia is the best answer because the trigeminal neuralgia is excruciating pain and needle sensation in lips, gums, and cheeks or chin. occurs spontaneously or with chewing, speaking, or smiling. Presence of the trigger zone, face, lips, and tongue. Provoked by the cold wind, brushing, or washing face. Female more than male. Next question. A man present with 30 minutes of severe pain behind the right eye with increased watering. He has had a similar episode before the ophthalmic examination. Diagnostic conjunctival injection and meiosis of the right pupil. What is the initial treatment? Sumatriptan, rizatriptan, steroid, high flow oxygen. High flow oxygen is the best answer because here the patient is suffering what? Cluster headache. Cluster headache. And abortive measure for cluster headache for a high flow oxygen. क्लस्टर हेडेक जो यूनिलैटरल कैसा होता है? यूनिलैटरल होता है एंड पेरी ऑर्बिटल हेडेक होता है दैट इज एसोसिएटेड विद इप्सीलैटरल ऑटोनोमिक सिम्टम्स होता है लाइक क्या क्या होता है? लैक्रीमिनेशन होता है, रिनोडिया होता है, हॉर्नर सिंड्रोम एंड ड्यूरेशन कितना होता है? 50 मिनट से लेके 3 आवर्स तक 50 मिनट से लेके 3 आवर्स। फर्स्ट लाइन ट्रीटमेंट हाई फ्लो ऑक्सीजन एट कितना देंगे? हाई फ्लो ऑक्सीजन 12 to 50 पर लीटर मिनट टू प्रिवेंट एंड फ्यूचर एपिसोड ऑफ क्लस्टर हेडेक। क्या देंगे? विरापामिल क्या करेगा? प्रिवेंट करेगा एपिसोड्स ऑफ क्लस्टर हेडेक। सुमाट्रिपेन फर्स्ट लाइन ट्रीटमेंट ऑफ माइग्रेन हेडेक है ये सुमाट्रिपेन है रिजाट्रिपेन इज एंड सुमाट्रिपेन आर बोथ फर्स्ट लाइन ट्रीटमेंट फॉर एक्यूट माइग्रेन headaches and steroids are used for prevention of further attacks of migraine. This one is the further attacks of migraine. So that's all today. Thank you and keep revising.